Hello, friends. I'm Dr. Jyoti Maheshwari, psychiatrist and psychotherapist. In my quest to make people aware about the importance of mental health and help them achieve a better mental hygiene, I've started this campaign, SwaMann. Swachh Mann, Swasth Mann. Under this campaign, we are going to have a series of webinars addressing different topics related to mental and emotional well-being. To be a part of the SwaMann campaign and catch me live in my next interactive webinar, follow the link below. So there is this quote by Anthony Robbins that successful people ask better questions and as a result they get better answers. And I'm sure all of you will agree that all of us are very successful people, and that's why we have lot many better questions. And what are those questions? Is what, why, and how. So what is this anxiety? What is fear? What is overthinking? What is worrying? And why do we go through so much of anxiety? Why do we face this problem? And then how do we deal with it? How do we identify it? And how do we deal with it? So these are the three main questions that comes to our mind whenever we are talking about anxiety. Right. So let's look at the first question. What is anxiety? What is fear? What is overthinking? Okay. So understand these concepts. Let me give you a few examples. And for that, I think I'll stop my slides. Yeah. Okay. So around it must be 5 or 6 years back. It was late in the night, around say 11:30 or something. I had finished all my daily course, and everyone in my family, they had retired to their bed. I was just kind of relaxing and unwinding myself, watching some show on television, sitting in my hall, 11:30, and I heard some commotion outside door in the passage of my building. I thought there's, someone has gotten into the heated argument. There's some fight going on between some people from the society. So I just opened the door and saw all my neighbors were outside, all the members in their family in the passage, and they're looking very scared and very puzzled, and they were in rush. So I just asked what happened. And they said there is a fire in the building. So even I got very scared, and I just ran inside the house, and I just, called up my son, my husband. That time my in-laws were with me. They were very old. My mother-in-law was bedridden, and we were very scared, we're restless, trying to just rush out. And obviously we reached down safely, all of us. And there we saw down in the society building, all the people standing there. That look was there on the face. And what was that look? What do you think everyone was going through? Yeah?
Yeah.
Anxiety.
Right? Anxiety, fear.
Fear is the right, I would say, is the word, right? Why fear? Because there was a real danger, right? So this fear emotion we also see into the anxiety. But what is anxiety? Let's understand by the second example. We will talk in detail about it, but first let's clarify the points. My eldest son, he's doing his MBA. He's a very bright student, very confident. He's coming to, his education, MBA is coming to an end. And there is a placement happens in all colleges. Thanks to maybe this pandemic, I could face that whole drama and excitement and whatever tension and everything of that placement happening online in my house. So I saw him, one of the interview, prior to interview, he was little bit restless and apprehensive. He was very well prepared and everything, but still he was little apprehensive, which I think many of us face when we have to face the interview, or we have to go for an exam, or sometime even if we have to speak in front of the public, address some people, right? So we have that nervousness, something called as maybe a butterflies in the stomach, right? Many of you must have experienced this. There are some trainers in the audience today we have, right? So what is this? is an anxiety. Right? This is not just fear, this is an anxiety. There's another incident, what I would like to share here is about my aunt. She has taken this trait from my grandfather about worrying of everything. Almost like, to give an example, if someone has to travel, she will be like, thinking about that, how you're going to go, when are you going to reach to the platform, whether you have taken tickets or not. There will be a list of questions going in and out. And or someone has gone out of a house, maybe her son or her husband, and there is like half an hour delay in their coming back, whatever time they have said, and there's a half an hour delay, then she would be quite restless. Her trips to the main door from her hall will increase. Okay. So this trait of worrying a lot, thinking, is a overthinking, but it's a personality trait. Obviously, it's also seen in anxiety. Okay. So even if people don't have as a personality trait, but when they go through the anxiety, they do experience this overthinking pattern. Okay. So we have this fear, we have anxiety, we have overthinking. Okay. If we have to put anxiety as such, there are three different components which are there. Okay. One is what is called as affective. Affective as in what we feel. As we've seen that fear is there. Like, why do we feel anxious before appearing for exams or for interview or addressing the people? Because that fear is there of how we are going to do. That apprehension is there. So that is the affective part, that uneasiness what we feel is. But there is also a physical part, physiological, which we see in the symptoms. What are those symptoms? We'll see in detail. And the third part is cognitive part. Cognitive part is in the thinking. So one is the overthinking, which is there. Then there is a lot of confusion in thinking, inability to focus or concentration. So these are the three, what I should say, the characteristics of any kind of anxiety. So this is a difference between normal anxiety and pathological anxiety. Okay. What happens in normal anxiety is it do not disturb the daily activity. Why? Because that worry is only about one specific issue. Like, okay, it's exam, it's new house, new city you're moving it to, or you're addressing to the people. It's very specific issue. And that's why it's only limited to that particular time. It's transient. It doesn't last long. While the pathological lasts long. And it is about, because it is about worrying of everything. As I told you about my aunt, she will worry about each and everything in her life. Normal anxiety, which is there, which is controllable. You can have that control, but pathological anxiety is uncontrollable. Even if you think, even if you know, no, this is not the way I'm supposed to behave, this is not the way I'm supposed to think, but still it's not under your control. Normal anxiety causes very mild disturbance, while pathological anxiety causes markedly distress. And that's why it affects even your personal life, your professional life, and your relationship. Everything gets affected. To understand this better, I'll again give an example so it becomes very clear. My uncle stays in very small village of interior of Maharashtra. Around 25-30 years back, when once he visited to Mumbai for first time. Before that, he had not seen any lift or didn't hear anything, because by that time we didn't have all this internet and everything. Right? So when he came here, he was very scared to enter the lift. He preferred to use the staircase, and he was not ready to go by lift. After coaxing him a little bit and explaining, somehow I managed and I got success in taking him inside the lift, and I made him do couple of trips in the lift up and down. And after that, he was like a child. He was very excited. And he said, okay, I would like to try it on my own as well. And he went on his own and did few trips in the lift. So initially, he was anxious. He was worried. Okay, he was a little scared of that.
That is what is the normal anxiety. But at the same time, there's another example of my friend who is staying in Mumbai for almost 20 years now, but he still will never take a lift. He always choose to climb stairs up and down, right? And he will always see to it that whenever he buys the flat, it has to be either on third or fourth. He won't go beyond that. Okay. Why? Because he's scared of lift. Not only lift, he's basically scared of any kind of a closed spaces. That's what classically called as phobia. But this is also an anxiety. It's a pathological anxiety. It's affecting his normal life. And it is in excess than normal anxiety. So I hope this clears the idea of what is normal anxiety and what is pathological anxiety. So this pathological anxiety is also what we call as anxiety disorders. Okay, so as you can see here, the symptoms what we are talking about. It's written under panic attack, but more or less all anxiety disorders have these symptoms. Like there's a palpitation, you feel as if your heart is racing very fast, there's sweating, sometimes you feel difficulty in breathing, like a choking sensation, there can be a chest pain, there's a trembling, sometimes you feel uneasiness in the stomach, fear of dying, and sometimes there can be hot and cold flashes. So these are all physiological changes, what I told you earlier, right? The cognitive part of anxiety is what? These are the physiological or behavioral part which is there. Okay. So all these symptoms are common for anxiety disorders. Now, why am I talking so much about this? Because it's very important to understand the difference between what is normal anxiety and what is pathological anxiety. Because many times I have seen in my almost 25 years of my practice that many times people take everything as that this is normal. Because it's a common, people take it as normal. And they suffer through all these anxiety problems for so many years of their life. And if they approach at the earliest, it can be controlled very well. So what are these anxiety disorders? The first being the generalized anxiety disorder, which is constant worry, which is there. Then there is the OCD, obsessive compulsive disorder. Obsession is the one word which has been used very commonly by the people, but without having the right understanding. Then there is this panic disorder, and also called as a PTSD, which is post-traumatic stress disorder. Whenever a person goes through trauma, after that, he feels anxious. And last but not the least is phobia. Here I've mentioned only social phobia, but phobia can be of going out, or there are different kinds of phobia which are called simple phobia. Social phobia is one specific part of it. So here we comes for the generalized anxiety disorder. Okay, can you make us some show of hands, or you can tell me how many of you have experienced anxiety sometime or other in your life? Almost everyone, right? Yeah. So that anxiety, what you experience, I'm sure few of you must have experienced in excess, but whatever you experience, even in for the one incident for small time or less in frequency, that same kind of anxiety is there continuously for everything, every small thing. It's as simple as that the person who is going through this GAD has the anxiety when he or she has to cross the road, or they have to go to the bank, which is the routine work, or have to go to the vegetable market. It's a simple daily activity, but they feel so anxious. There's a constant worry which is there, and that affects their sleep. They're not able to sleep. They always have this muscle tension. Many a times they don't realize, and then they land up having chronic body ache. Maybe backache, neck pain, headache, must have seen. So people may feel that, okay, we don't have any kind of anxiety, we don't feel, but they have this lot of aches and pains in body. So that anxiety has transformed in the form of physical symptoms. Right? So these are the constant generalized anxiety disorder which is there. Many a times this is also seen as a symptom of any other illness also. But when it's purely present continuously throughout the life, most of the day of the life, then it's called the generalized anxiety disorder. The second one is panic disorder. This is very classically, it, what I can say, resembles to the heart attack. That's why very commonly people who have this panic disorder, the first thing comes to their mind is, oh, am I having heart attack? Am I having any problem with my heart? No? So many times people who are having panic disorder land up going to the cardiologist. First preference is generally they go to the cardiologist thinking there is something wrong with their heart. So again, whatever symptoms you have seen of anxiety, the classically in panic attack, what happens is all these symptoms suddenly they start. And in a matter of few minutes, they reach to the highest intensity. After some time, it also subsides. So it's kind of a peak. It's not continuously there. Like in generalized anxiety disorder, it's continuously there. But while in panic, it goes up and comes down in a matter of few minutes, let's say 5 to 10 minutes, or maybe sometime it lasts for half an hour also. And what is classic about this panic disorder? See, what I have explained right now is also a panic attack. It can be seen even in depression also. But what is panic disorder? In panic disorder, once the person has the attack, there is a fear of another one. Person feels that person is going to have, and that creates more anxiety. That anxiety again has another attack. So this cycle goes on. That is very classic in panic disorder. Because of this fear of having another attack, they many a times avoid going out also. And that's called agoraphobia, which we'll be seeing now. Right? So phobia is actually again a fear only. But in fear, there is an actual danger. What I explained you as a fire, what we had, or maybe sometime if you experience what you say, any wild animal, or for that matter, currently in pandemic, okay, the fear was there of catching the infection, okay, getting infected. That was real fear. But once it's getting over also, when it remains, and maybe the thing or object, which is actually not so dangerous, even the person feel anxious and fearful of that. That is what is the phobia. Okay. So it is an irrational, persistent and excessive fear of any object. Even if they are not actually, in reality, they are not dangerous. Something like, as I explained with my friend, the lift, it's actually not dangerous. But he was having that fear. He was having that phobia of fear. And person knows that this fear is actually unfounded. There is no base for it. But still person is not able to control it. And because of this fear, they tend to avoid the situation. Like again, as in my friend's case, he was avoiding the lift. Yeah. So this is what is the phobia. Let's understand what are the types of phobia. What I explained about panic disorder, the agoraphobia, where the person has fear of going out, person avoids. They remain in their house. They don't go out, or they need someone to accompany them. That is what is the classical agoraphobia, which is there. Then there is a simple phobia. Fear of spider, fear of cockroach, mainly with the ladies, many people, or lizards, they have this phobia. Some people have fear of heights, or sometimes it can be fear of water. Like I just had one patient, she would avoid to go to any place because whenever her friend used to plan any picnic or something, and if they planned it anywhere in the beach or something, she would avoid. Forget entering into the water, she won't even go to the beach because she had this phobia of water. And then fear of flying. Again, it's very commonly seen. People tend to cancel their meetings because of this. And this is trypanophobia, is fear of needle. Very important. If someone of you have, then it's going to be difficult because you have to take the vaccine now for the COVID. So people who have this fear will find difficult to take the vaccine. So many of different kinds of phobia. See, as far as it's not affecting your daily life, it's not affecting your personal, occupational life, it's perfectly fine. I mean, if you're managing it. But if it's going beyond that, I would really suggest that please take the help. Because these are the things which can be handled, which can be tackled. You can overcome all these fears with the proper treatment. With that, let's go through another specific phobia which many people share, and that's social phobia. See, social phobia is not only to talk to the people or address the public meeting or address the presentation in the office. It's not only that. If person is having social phobia, sometimes they even avoid to go to the restaurant for the meals because they're under constant fear that people are observing them. People will make some comment. They will make fool of themselves, or they will drop food and people will laugh. No, so these are the features of this social phobia. So it's not only addressing people, but sometimes even being into the gathering, even the social gatherings, okay, where you are not the center of attraction, but people avoid to go. So this is what is the social phobia. This brings us to now the third category, what is PTSD, post-traumatic stress disorder. This we have seen commonly, many patients while I was working in JJ Hospital after those riots broke around in 92, 93, the Bombay riots which happened after that. So what is the classically, see, any kind of trauma when person goes, whether it is a natural calamity, whether it's a riot, anything, after the incident is over, person is very scared. He gets images of those past situation. Those are called flashback. Or the person becomes very easily startled, hyper vigilant. Even if someone comes and opens the door, person is like, he feels very scared. On the small noise also, person becomes very startled. Like recently, I'm seeing one patient who has seen the dead body of her close friend who was murdered. Okay, so even that has got the lot of psychological effect on her. Her sleep is affected and she sees all these flashbacks. So this is what is the PTSD, post-traumatic stress disorder. If anyone has this, definitely immediate help is very, very, very important to take. Then comes the OCD. Very common, but very, what I should say, very less people come ahead and they take the help. Okay. So OCD, what is OCD? Is obsessive compulsive disorder. See, obsession per se, the word is used very commonly. People talk like, it's rather, I would say, overly used. For anything they'll say, even if they like or something, oh, I'm obsessed about this, I'm obsessed about that food, I'm obsessed about this particular show. Okay? So that obsession is not what is there in OCD. In OCD, this is a cycle which is there. The person has obsession, which creates anxiety. And because of that anxiety, person has certain compulsion, gets the relief, but that relief is very momentary. It's for short time. And that's why a person again starts having this obsession. What are these obsessions? Let's understand in detail. So obsession is nothing but your own thought or your own, any kind of an image or idea, any kind of feeling, sensation in your brain, which is happening repetitively, and it's intrusive. What do we mean by intrusive? That it's your own. It's not that someone else is putting. Why I'm making this specific? Because there is one condition called schizophrenia where person feels someone else is putting thoughts in their mind. So in obsession, it's not that. The person who is having obsession knows it very clearly that these are my own thoughts, my own images, but person does not want it. still they are coming repetitively. And that makes the person feel very uncomfortable. Person feels guilty, feels disgusted about it. And person develops the urge to do certain activity to get rid of it. That activity is what called as a compulsion. So compulsion is very consciously, with all the knowing, person do this action again the repetitively. As I said, that why its repetition is there, because once you do it, it gives you relief only for some time. Again, the obsession crops in, and again you have the urge to do this activity. That is why it is done repeatedly. So now let's understand this OCD little in detail with the example. There are different types of obsessions and different type of compulsion. The very common obsession is of contamination. Contamination as in, if you touch anything, you feel, okay, there's some dirt has come on your hand got dirty, okay? And then you go and wash the hand. So washing hand is compulsion. You'll say, oh, that what is there so great about it? I mean, many of us feel, and especially again with this corona thing, this has happened, like every one of us were going through almost like a OCD thing, but it was required. Okay, and whatever was told, we were doing only for that time. But certain people have developed OCD and they were doing repeatedly again and again, they were going and washing hands. Some people who had the OCD earlier, that has increased during this pandemic. And what is happening is people, they are not only washing their own hands, but they are insisting even their family members, they do it repeatedly. Okay? So this is very classical contamination, anything, like even not only hand. You may find that certain object, if it has touched, like, you touched your purse somewhere, you touched your clothes somewhere, you have to wash that. Then there is second type of obsession is of harm. Many times person gets this thought that, okay, like I had one patient, she had this thought in her mind that she is going to kill her child, kill her son. So she would all the time will keep checking, am I done? She'll keep checking on her son, she'll keep checking on herself, that whether she is doing any kind of harm to her child. Child was very young and she would always feel that maybe, she will pick him up, she will throw him somewhere, or she will do something with the sharp object. That thought. And just imagine, when you, as a mother, you think something like this, how bad you feel, how guilty you feel. So that anxiety is too much. And that's why this checking behavior was increasing again. And third is perfectionism, very commonly seen. See, there is a difference between, again, here, perfection as a trait, certain personality traits. Certain people are more perfectionist than compared to others. But it is limited, it's not affecting their life, throughout the life. The intensity is also low. While in OCD, if that perfection is there, people are very particular about certain numbers or certain colors, or they want to arrange the things in particular manner. Like I had one patient who would keep all her clothes arranged in the color code, that all blue clothes will go here, all black clothes will go here. So something like this. So arranging, redoing, that keeps happening with perfectionism. Or there can be a religious. Sometimes person gets these thoughts. One of the patient had this thought that, okay, if he doesn't pray in particular manner to the God, then something bad is going to happen. Or he feel when he looks at the God, if there is an image of that God gets distorted in his mind, and that creates anxiety. So he has to keep praying. Okay, maybe in particular fashion, that you have to do this 3 times, do this 5 times, something like this. So all these are the compulsive behavior which are there. Similarly, there is an aggression or sexual thoughts also. Like as I said, the harm, people get these thoughts of having aggressive attitude or sexual behavior towards someone. And then they again have to repeatedly check it, whether they have done it or not, or maybe say some kind of mantra repeatedly, or do some action repeatedly so that they don't get these kind of thoughts. But sometimes they feel that they are going to lose the control. Lose the control as in, if they are talking something, they will lose the control and they will utter some words which are not to be said to anyone. So they'll keep asking to the other person, oh, have I said something like this? Have I said something like this? Have I uttered these words? So that is what is the compulsive behavior. Okay. So these are the different kinds of obsession and compulsion. And it's very commonly seen, people don't come ahead at the early stage. They come at very late stage. And friends, let me tell you, if people take the help at very earliest, this OCD can be controlled. But only because, one, the person himself or herself realize that what is happening in their mind is actually not right. It's not up to the societal norms. And that's why they tend to hide. They don't come out. They don't talk much about it. So there is a delay in taking help. Many a times we get reference from the skin people, skin specialists, because of continuous hand washing, they get all the eczema and other skin reactions, for which they approach the skin specialist. So before going to psychiatrist, they go to the skin specialist, and we get the reference from there. So my again, sincere and humble request: please be very vigilant. If any of you are around you, any of your family members or neighbors or anyone who has any kind of behavior, please guide them and help them to take the timely help. Because this is something which can be treated at the earlier stage. Otherwise, once it becomes chronic, it's very difficult. And not only for the person or patient who is suffering, but it is for the family members as well. It becomes very difficult. These are the anxiety disorder, the pathological anxiety which is there. We have seen why this is happening. I mean, what are these? So now we come to why, the second question. What is anxiety? We know. What is normal anxiety? What is pathological? But why do one has this anxiety problem? So these are the four categories basically. When we say, the very commonly accepted theory is genetic. Genetic as in what? If you have any family member has the history of anxiety disorder, or any person having, so their children, the chances they getting anxiety are more. Okay, that is one. Second is genetic makeup is as such that there is a tendency of having this chemical imbalance. And because of this chemical imbalance, there are different types of neurotransmitter in our brain. We are not going in detail of that. But if that imbalance is there, the person tends to have this anxiety disorder. So in similar situation, everyone won't go through the anxiety. People who have that kind of a genetic makeup, they will be more prone for that. Same, there are certain personality types. As I was telling, that there are traits like the avoidant, dependent, perfectionist, or rigid. These traits, whichever personality has, they tend to have the anxiety. Very commonly earlier used to known was the type A personality. You know, people who are very much in rush, the hurry, worry, curry used to be the common thing about it. So people who are always in rush tend to have a little more anxiety. Then is the biological. What is the biological is? There are certain physical as well as psychological illnesses which also gives rise to anxiety. So their anxiety is a part of symptom. Like in tuberculosis, there is a cough also, there is a fever also. Okay. So similarly, here, any particular illness which is there, the anxiety is only a part of it, symptom. Something like, again, heart problem, which I explained earlier also, any kind of heart attack or something which is there, or there is an endocrine disturbance, the hyperthyroidism which is there, which also sometimes gives rise to anxiety features, or person is having hypoglycemia, or for that matter, person is having any neurological issue, something to do with the brain, or the depression. The common psychological problem which also has the anxiety as a symptom is a depression. And there are certain medicines, like some steroid hormones or steroid medicine, there are thyroid medicine, and also there are some anti-allergic medicine which can also give rise to anxiety disorder. Why I'm talking about all this? Because obviously, see, family, whatever genetic makeup, you can't do much about it. Okay, the personality which is there, if personality trait, that can be dealt with the therapy. If you know these biological causes, so what is required is whatever the cause is there, whatever illness is there, we need to treat that illness so as to get the relief from anxiety. And what is third very important factor is a psychological. There are three things. Please remember this, because we will be referring to all these three in later part of our presentation. One is the learned behavior. That you learn this particular behavior of anxiety, being a little restless. Any particular, you associate one topic, one subject to the anxiety, to the fear. Okay, and then you learn to react or respond to that particular object in the similar manner. Just to give an example, suppose someone is scared of dog. Okay, so once suppose it happens that person is going and dog just jumps on that person, so that he gets scared. So next time, whenever he is seeing that dog, it may be with only same dog. If it gets increased, it may happen with any other dog. The moment he sees only sight of that dog, and he will feel very panicky and very anxious. So that is what is the learned behavior. There is an association between this. Then there are cognitive distortion and faulty belief system. What is this? We'll be talking little in detail when we talk about how to deal with it. So remember, but these three things very clearly. It's learned behavior, cognitive distortion, and faulty belief system. These are the things which leads to anxiety in us. So that brings us to our last question, how? How, as in two things. How do we identify whether we are having anxiety? Like some of you will have question, how do I know whether it's a normal anxiety, whether it is a pathological anxiety? How do I understand? And second, how do I deal with it? Right? So how do I know? For that reason, I had sent the Google form. Some of you have filled, and I had asked you to keep that score ready with you so that it's for your own reference. I'm showing you how to. So here is anxiety score. All of you, you need to see where you lie, where you fall, in which category. The person who are having score from 0 to 8, it's minimal. It's perfectly fine. Somewhere into the normal anxiety zone. When mild will come there, that person is able to handle it. It's not out of control. Moderate is somewhere one has to be a little careful. It's going towards danger zone. The person who is having the score between 16 to 24. And from 24 onward till 40, it's a danger signal. It's a warning signal. If anyone is having score above 24, please take the help. Don't just sit with your anxiety. Take the help and lead a very healthy and normal life. So the whole purpose of sending that scale was this, so that you become aware about your own state. Having said that, we are coming to our last topic is how to deal with it. So the very, the important factor to be remembered anytime anxiety which is there, not to just let go of it, but act onto it. So what do we mean by act onto it? So A is for awareness, C is for calm, and T is for the therapy. Let's see a little in detail. Awareness about what? As I said just now, a few minutes back, that awareness about your own state. Where do you lie? Do you have a mild anxiety? Do you have a major anxiety issue? What kind of anxiety? Is it phobia? Is it OCD? Is it generalized anxiety? Or are you also having depression? Be aware of it. Be aware of your own trigger factors, because sometimes there can be some trigger. You may see some person and you feel anxious. You may have to visit certain place and you feel anxious. So if you're aware of your triggers, maybe you can avoid those places or those person, if it's possible, right? That can be done. If not, then learn to alter the situation. Alter yourself and accept whatever is there. But all that can be done only when you are aware about it. Many times we are not aware. We just get these feelings, get these symptoms of anxiety, and we really don't know. Many times I get the patient, they say, this is what is happening. I don't know, doctor, why it's happening, but I just feel like this. And when we sit and just analyze it and go back, we reach to that trigger point and then we work on it. So it's very important to be aware of it. But unless until you know what is the problem, you won't be able to do anything about it. Then once you know what to do, so calm down. Okay. Because anxiety and relaxation, these are the two opposite things. So whenever you're feeling anxious, if you calm yourself down, then obviously anxiety can't be there. The two opposite things can't stay together. There is something like, hot water and cold water won't be going together, right? So it's something like that. So you need to calm down. I will say, okay, doctor, this is like, we know that, but how do we do it? I mean, we are anxious. It's really difficult in that matter. So let's say how to do about it. I would like all of you to try this out, okay? If you can also on your video will be good, or otherwise you can do it yourself. So just put your two hands like this as tightly as possible. Just close your fist. Just do it very tightly, as tightly as possible. Your whole focus is in both your hands. Just hold them very tightly. Feel that pressure. Are you able to feel it? Right? Yeah. Just feel that. And now, slowly release it. Just release it. Just release it. Just release it. Yeah. So can we take one or two sharing what happened?
Feeling relaxed a bit.
Yeah.
Some relaxing feeling.
Right. When you release it, you feel that relaxation, right? So this is the principle behind it. See, when you are anxious, you're already tense, but you don't realize that tension in your body and you are not able to release it. So this is consciously you tense your muscles. Okay. When you're consciously doing it, you are kind of increasing that sympathetic activity. You just clench it and then release it. While releasing it, the other muscles of your body, they also get released. Their tension also gets released. Okay. So this helps you. Whenever, if you're feeling anxious any moment, just do this exercise, very simple, and find the difference in your anxiety level. Second is abdominal breathing. Again, here I would like you to experience yourself. Just put one hand on your chest, one on your abdomen. And right now, just close your eyes and feel the movement of your abdomen and chest. Don't do anything with your breathing, but just feel the movement of your abdomen and your chest. You will feel that right now it's the chest which is moving more than your abdomen, even in normal breathing. And in anxiety, definitely it's there, that hyperventilation. The chest, it's shallow breathing. The chest is just moving faster. Okay. So in that, what you need to do is, if you're feeling anxious, just put it and consciously try and breathe from your abdomen. Take a deep breath. So just try and do it. It's also called deep breathing, diaphragmal breathing, abdominal breathing, whatever name may be. But just deep breathing is very important. Okay? Because in anxiety, you tend to start having very hyperventilation, the shallow breathing. When you consciously breathe deeply, it helps you to calm your mind. Law of distraction. Generally, this law of distraction is applied in today's generation when there are mobiles and everything which gets creates this distraction and mind gets diverted, right? So it is used in bad way, but here in anxiety, actually it is helpful. That's why I've written when distraction is good thing. You have to distract mind. As Nidhi has rightly said, whatever is your focus of this, you have to distract your mind from that. It can be anything. Like in your case, it's a sleep. You can listen to music. You can talk to a friend, but distract your mind. Like just before you're going for any presentation, don't think about it. Maybe you talk with someone. I know one of my friend who is a trainer. He would do some push-ups before he could, before he would start addressing the meeting. Okay. So that was his way of distracting his mind. So law of distraction is just distract your mind from whatever you're thinking about whatever is the focus of your anxiety, shift your mind from that, divert your mind from that. And last but not the least is mindfulness and meditation. What is mindfulness is basically just being in this present moment, a presence of mind. What happens in anxiety actually, we are always thinking about the future. See, before exam also, why we feel test? Because we are thinking about the result. Or we think how we are going to fare in the exam, or how we are going to do into the interview. So it's always what we are focusing on the outcome, and we are not focused on the process. So mindfulness is nothing but being present in that moment. Obviously, again, here, it won't come easily if you are already anxious, right? You need to practice it throughout your life. Okay. Keep practicing it so that it comes very easily, it becomes handy when you are facing any kind of anxiety. Okay. So mindful meditation, just to summarize, what is the way, if normal anxiety is there, how do you deal with it? As I said, there is a clench and release exercise, the abdominal breathing, law of distraction, distract your mind with whatever music, exercise, anything, and mindfulness and meditation. What is the last T, the therapies? First is systematic desensitization. It's nothing but desensitizing. Remember I told you what is that cause psychological, learned behavior. When we learn to associate one particular part, one particular object or anything with the anxiety, okay? So what we do here is dissociate that. This is a systematically, step by step, we take the person through this whole process and desensitize from that object. As I said, whenever we are tensed, we cannot be relaxed. Or if we are relaxed, we cannot become tense. So what we do in desensitization, first we teach the person all the relaxation techniques. And once the person gets trained in that relaxation, which is also gradually, step by step, we increase the depth of relaxation, then we introduce that object of fear. Okay, it can be object, it can be thought. First, it is introduced into the mind, in the person's imagination. That person is asked to imagine that particular object. Now, when person is relaxed and is thinking about that object or imagining about it, he cannot feel anxiety because he's already relaxed. These are the two opposite emotions or opposite state of mind, cannot remain together, right? And then slowly, in some cases, we also actually desensitize with the actual object. Like, person who is afraid of, suppose, say, cockroach or something. So, just making person stand where there is a cockroach or something. Just for example, I'm giving you, right? So this is what is the systematic desensitization commonly used for the treatment of phobia and OCD, obsessive compulsive disorder. Then second is a psychotherapy. In psychotherapy, we have many different therapies. Commonly used are CBT, like cognitive behavior therapy, rational behavior therapy, that is REBT, and there is something called as the reorientation therapy. Okay, so all these therapies, what do? They help you in correcting all those cognitive distortion and your faulty belief system. Whatever those distortion which are there, what are those distortion is? All or none. Like, I can either do really good or I will just fail. Okay. Or there is something like mind reading. You feel that, okay, person is reading my mind. And I mean, you have the ability to read person's mind, and you feel person are talking bad about me or they are making fun about me. So this is just in your mind. You think that you know what people are thinking. So these are just to mention few of the examples of cognitive distortion. And faulty belief system is something like where one has the belief that I should not have any kind of discomfort in my life anytime. No, I must be successful all the time. I should never feel the failure. These are the few to name again. So these are the faulty belief systems. So during psychotherapy, we help the person, we guide the person, we take them through the whole complete technique, how to work on their thought process and how to correct that belief system, how to correct those cognitive distortions. And all of them have this role to play. But definitely there are certain issues, certain anxiety disorder where pharmacotherapy is very, very much required. Okay? Something like obsessive compulsive disorder, OCD, or PTSD, where pharmacotherapy means treating the illness with the medicine. Okay? Again, there are a lot of misconception about this medicine, where person feel that, okay, I'm going to get habituated, okay, or they feel it's never going to, we will never be able to stop them, or we will have a lot of side effects. This is not the addiction actually per se. You're not getting addicted to medicine. This is a treatment. What you get to addicted is to alcohol or smoking, which actually in turn increases your anxiety. And many people uses this, or for that matter, even coffee people use it. So coffee also sometimes increases your anxiety. Okay? So medicines are very safe. Nowadays, there are newer and newer medicines which are coming up. And obviously, but you need to take it with the consultation of psychiatrist. Don't do it on your own. So these are the three very important ways to deal with it: systematic desensitization, psychotherapy, and pharmacotherapy. When you have the pathological anxiety, trust yourself. You have survived a lot, especially in this pandemic, and you shall survive whatever is coming your way. Right? So don't get very panicky about the panic and about anxiety.
If you like this video, drop thumbs up and share it with your friends and family. And do subscribe to my channel for more such content.